Today's legislative hearing builds on the committee's critical bipartisan work to expand telehealth services and access to care for Medicare beneficiaries. Telehealth has many tangible benefits, and research has shown that telehealth has clinical benefits for patients. It can also provide critical services to hard-to-reach populations and help underserved communities access healthcare providers. And we have a long history of leading the way in this committee to expand access to telehealth services in the Medicare program. The Bipartisan Budget Act of 2018 expanded access to telestroke services and provided additional flexibility for accountable care organizations to expand use of telehealth. The Support Act expanded access to substance use disorder services delivered through telehealth, and the Consolidated Appropriations Act of 2021 permanently expanded access to telemental health services. Now, during the COVID-19 public health emergency, this committee led efforts to significantly expand access to telehealth. We moved quickly to waive statutory requirements with respect to telehealth services under Medicare for the duration of the COVID-19 public emergency, and this was critical since seniors were some of the most vulnerable to COVID-19. We also expanded the scope and duration of the Medicare telehealth flexibilities in the Consolidated Appropriations Act of 2023 and extended many telehealth flexibilities through the end of this year. Expanding access to telehealth services during the COVID-19 public health emergency helped save lives and preserved access to necessary care for millions of seniors. The expansion of telehealth flexibilities has allowed Medicare beneficiaries nationwide to continue to receive telehealth services, including audio-only services, without ever leaving their homes. And these expansions have resulted in millions of seniors accessing care. The Medicare Payment Advisory Commission, or MedPAC, has found that telehealth utilization and spending in Medicare has increased substantially, and the use of telehealth services among Medicare beneficiaries has also continued to remain high and far above pre-pandemic levels. But I believe that any further expansion of telehealth flexibilities in Medicare must meaningfully increase patient access to care and ensure high-quality care for seniors. So as Congress considers further expansions of the telehealth flexibilities in Medicare, we must continue to assess and monitor the quality of these services, including audio-only services, to ensure that Medicare beneficiaries are accessing high-value, high-quality care. It's also vital that CMS has the tools and data necessary to monitor the quality of telehealth services that beneficiaries are receiving. So I'm interested in hearing from the witnesses today on how telehealth policies can encourage the use of high-value care while at the same time discouraging potential low-value care in the Medicare program. And while there are significant benefits to telehealth, Congress must ensure that additional expansions of telehealth policies do not limit access to in-person care. It's important that we preserve patient choice and that Medicare beneficiaries continue to have access to high-quality in-person care and robust consumer protections, including network adequacy standards. For example, telehealth should not be used to undermine network adequacy standards in the Medicare Advantage program. In providing increased access through telehealth, we also need to ensure that we're not further fragmenting care and that telehealth is being used in a way that facilitates coordination. And Congress also needs to continue to monitor any program integrity risks associated with telehealth billing, such as those identified by the HHS Office of Inspector General. So finally, I understand that some of these legislative proposals are likely to have major scoring implications, and we still need the Congressional Budget Office's feedback on their costs. I'd like to better understand the offsets for these proposals and want to ensure it would not result in significant funding cuts to the Medicare program or raise health care costs for seniors. Today's hearing is an important step in our continued efforts to make health care more accessible for seniors, and so I look forward to what the witnesses have to say. Thank you, Mr. Chairman. I yield back.